The impact of a huge epidemic, like a flu epidemic, would be phenomenal because all the supply chains would break down. Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. We're not ready for the next epidemic. The impact of a huge epidemic, like a flu epidemic, would be phenomenal because all the supply chains would break down, there'd be a lot of panic, many of our systems would be overloaded, and so we all hope that doesn't come along. But being ready for epidemics of different sizes, there's a lot more we should do. The resources to go engage in the affected countries, the allocation decisions. As we've seen various flu scares come along, we haven't had a super good response. Using the flu vaccine doesn't really work that well in the equatorial regions because you don't get this lead time like we do in the northern hemisphere. But a universal flu vaccine, I think, would be brilliant because it would reduce pandemic risk. I also think the human health benefit would be larger, particularly in developing countries, than we'd expect.
Bismillah wa salatu wa salam rasulullah wa ba'd. Now, for the coronavirus, the time I realized it was something very serious was when the NBA said that they were going to suspend all games. And once they did that, I told my wife in secret that if the NBA is suspending all games, everything's going to get suspended. And sure enough, the next day, everything got suspended. The NHL, even the Parliament here in Canada. That's when I knew that the pandemic was a pretty serious thing. And furthermore, in Canada, like, our politics are pretty normal. It's not like the States, it's very bland, very dry. But in Canada, they started shutting down things. So that's how I knew this was a serious thing. Now, I avoided this topic because, there's so much information out there about it. But however, what's happening in America is a disaster. It's a total disaster. It's a crap show, and that's just saying it nice. And I'm putting this video out to warn the people out there that they should be very prepared for what's going to hit them. So let's get right into it.
I'm Dr. Emily Porter. I'm a board-certified emergency physician in Austin, Texas. So I'm also happen to be the sister of Katie Porter, who's a representative in Congress, who about a week ago made national headlines for her whiteboard. Right now, we're in the middle of this coronavirus outbreak. And everyone is really confused because they don't understand why are the bars closing? Why is everyone hoarding toilet paper? And what does social distancing mean? What does flatten the curve mean? I'm going to show you on my whiteboard why doctors, governors, and other people around the country are concerned about coronavirus and why every American should be. And really everyone around the world should be. So numbers-wise, in America, we have 331 million people. So the CDC is estimating that about 40 to 70% of them will get infected. So to make the numbers easy, I'm going to say that it's 150 million people. That's about 45%. So on the lower end of that 40 to 70%. So if 150 million people get infected, 80% of them are going to be just fine. So 20% of people will need hospitalization. Italy has a big problem right now, and they don't have enough hospital beds for people. Well, they have more hospital beds per capita in Italy than they have in America. So 80% fine, 20% need a hospitalization. 5 to 10% of the 150 million that get infected are going to need a ventilator, life support. What it does is it helps their lungs rest, it helps their heart rest, it gives their body time to heal because we don't have a cure for this virus, we don't have an antiviral drug that works, and we don't have a vaccine. Let's say 5% of the people need ventilators. 5% of 150 million people is 7.5 million vents needed in America. So I started thinking, well, how many do we have in America? Like, I'm in Texas, it's a big state, we've got a lot of big hospital systems. We probably have more than enough to take care of everybody. So I looked it up, and in Texas we only have about 4,000. And so America-wide, we have about, they estimate between 72,000 and 120,000. We're going to say we have 150,000. So let's say we have 150,000 vents available in the country. 0.02% of people could get a ventilator if they needed one. 1 in 50 people who need a ventilator can get one. That means that 49 people out of 50 are going to die. That is scary. That should scare you. That scares me. That should scare everybody who can understand basic math, including my second grader, that 1 in 50 are bad odds. So what that also means is that the doctors have to choose who that 1 in 50 is. Can you imagine? Can you imagine if you had to say, oh, I'm sorry, you have had cancer before, so therefore you don't have a perfectly clean bill of health, so you're not worth saving. Can you imagine saying, oh, I'm sorry, you're 80 and I've got a 30-year-old that needs the ventilator? Making those choices, because that's what they're doing in Italy right now. Unless you want somebody to decide whether you're worth saving, or your dad, or your sister, or your baby, or your grandma is worth saving, you have to do your part to prevent us from having to make these decisions, because we're heading there, and we're heading there very, very quickly. So you've heard about flattening the curve. This is what that curve means. The number of cases of coronavirus, if we don't do anything besides just what we've been doing, if we follow other countries' leads, it's basically exponentially growing. It means it doubles to triples every 2 days or so, roughly. And this is the healthcare system capacity. That's a line. If we don't do anything without protective measures, we're going to end up here, above the ability to take care of everybody. What that means is that all these people, and probably more, die. They die because we don't have ventilators for them, and we have to start playing Russian roulette of who's going to get saved. We're practicing social distancing. We're not going out of the house except to the grocery store to go for a walk. Those are the protective measures, as well as hand sanitizer, washing your hands, covering your cough, sneezing into your elbow. I get it, like it stinks. My spring break got canceled. My kids are devastated. I don't want to homeschool children. I work full time. I'm not saying it's ideal, but it's what has to be done, the experts are saying, to prevent this from happening. There's a million reasons to be angry and unhappy and just think that this whole thing sucks, because it does. But what really sucks is losing 47 million people. So I'm washing my hands, I'm doing my part, and I'm also just listening to what I'm being told by the experts, and I really hope that you can too. This is about everybody coming together for the common good, that we want a future for our children. And it's 2 weeks, man. It's like 2 to 4 weeks. And I hope that if you care about anybody other than yourself, including especially these 47 million Americans, that you will also do the same and just not complain about it and just do it.
Fast-breaking developments in the coronavirus emergency in the U.S. and around the world. The number of cases soaring just today. More than 24,000 now nationwide. New Jersey today becoming the 6th state to close all non-essential businesses, joining California, New York, Illinois, Pennsylvania, and Nevada. More than 80 million Americans now told to stay at home. New York State with more than 11,000 cases, and now New York City with new rules on who will be tested. Plus, Governor Andrew Cuomo's alarming prediction. He says 40 to 80% of people will ultimately become infected. Across the country, some hospitals bracing for the worst, beds filling up with patients, critical supplies in some cases running dangerously low, and healthcare workers afraid they will have no way to protect themselves. Vice President Pence saying he and his wife will both be tested after one of his staffers became infected with the virus. And as we come on the air, the FDA late today revealing a new rapid test will be available at the end of the month, giving results in hours instead of days. ABC's Diane Macedo leads us off.
Tonight, the so-called epicenter of the coronavirus crisis in the U.S. is making drastic changes to COVID-19 testing.
We have to keep focused on where the need is greatest, and that's how the testing programs will go.
The New York City Health Department is now limiting testing to hospitalized patients only, in hopes of not only preserving tests for the most ill, but also preserving the protective equipment required for each test, equipment that protects healthcare workers and is in short supply. But Dr. Anthony Fauci, the nation's top infectious disease specialist, says not every American needs to get tested.
When you go in and get tested, you are consuming personal protective equipment, masks and gowns. Those are high priority for the healthcare workers who are taking care of people who have coronavirus disease.
Officials say the priority groups are those that are hospitalized, symptomatic healthcare workers, and seniors, especially those in long-term care facilities or those with pre-existing conditions. We spoke to a nurse in Buffalo, New York, who returned from a trip to Thailand with symptoms. She hasn't been able to get a test.
I think that I possibly could have the COVID-19 with the symptoms that I'm presented with. I am a registered nurse in the operating room, so it is concerning that, there's not tests available to test us before I do return to work.
So this is a situation in the States now that they don't even have enough tests for the medical professionals that are supposed to help the sick. So this whole situation stretches far beyond just the virus itself. You have to imagine there's going to be sick people. There's going to be nurses who are stretched thin. Of course, there'll be doctors and nurses who are going to catch the virus and possibly pass away from the virus because it's happened in every single country so far. Then you're going to have other people with other illnesses have nothing to do with corona who won't be able to get medical care because there are not enough beds in the hospitals. And then those people will probably get further injured or possibly pass away from their illnesses because they just simply can't get care.
Scenes of desperation inside a hospital in Italy. New York, now the epicenter of the coronavirus outbreak in America, is trying to avoid this. But New York is facing a shortage of ventilators like this, needed to keep sick patients breathing. Thousands more are needed. They don't exist.
We have about 5,000 or 6,000 secured. We need 30,000. Federal government has 12. I mean, this is a bad situation.
But it's not only a lack of medical equipment for patients, but also for those trying to help them. Doctors, nurses, and staff at hospitals just like this in New York City are on the front lines of the crisis. And many of these health professionals say they're lacking some of the most basic essentials to protect themselves, such as gloves and masks. Hospital staff taking to social media to call attention to the desperate situation. This emergency room doctor tweeting, "I'm lucky. I got the last pair of goggles in the ER for today. It's 9 a.m. This doctor had to ask strangers for donations of new masks. I found 2 boxes on my doorstep this morning," she tweeted. "Thank you to whoever you are." And this is what New York City officials say they will need by early April. 3 million N95 respirator masks, 50 million surgical masks, and 25 million surgical gowns and gloves. Most of these products are made in China and in short supply on the global market. So New York's mayor has gone so far as to say the U.S. military is the last resort.
If we expect those goods that are produced that we need for our hospitals to get there in time, there's only one organization that can guarantee that, and that is the United States military. When will President Trump give the order? That is my question. When will he give the order?
If the supply problem isn't fixed soon, this stark warning.
We might get into that terrible ethical problem that the Italians are unfortunately finding themselves in, which is who will live and who will die? Who will get the ventilator? Who will be taken off the ventilator and who will be given it instead?
For New York, a need for medical supplies, and soon. Gabriel Elizondo, Al Jazeera, New York.
It's terrifying, this pandemic, which is spreading all over the world, as you've so comprehensively reported. And it's doubly terrifying that we have a complete nitwit as president who understands nothing, listens to nothing, judges nothing except by the stock market, and is endangering the American people. So it's just hard to believe what a colossal mess our country is in. Not only a virus to which the world population is immunologically naive, in other words, one that can spread wild and rapidly everywhere because there isn't acquired immunity, there isn't experience with this virus, but a president who is certainly the most incompetent president in the history of our country, who not only has personal incompetence, but is completely unable to bring together and listen to qualified people like Dr. Fauci and others who should be helping to control this pandemic. Instead, we have one ignoramus after another without guidance, without strategy. So every mayor and governor in this country is on the front lines without federal support. And Congress, it's just bewildering. There should have been money available immediately to the states and cities for every emergency step to actually fight the pandemic. Instead, they're talking about the airline industry. They're talking about which bailouts of which sectors instead of fighting the spread of the virus. The focus should be seriously on stopping the spread of the disease, keeping people protected, helping the health workers, and especially helping the mayors and the governors around this country who are on the front line. There should have been immediately an emergency $100 billion, $200 billion for the governors and the mayors to quickly be able to get the financial flows so that they can hire emergency social support. They can take whatever measures are available given the supply constraints for the hospitals, for requisitioning a safe space, for enabling there to be a viable and civilized shutdown so that people who are in isolation can survive this period. That's the first order of priority. It should have been one day to recognize this. It should be supervised. If we had a functioning CDC, the Centers for Disease Control, by CDC, by NIH, by the National Academies of Science, National Academy of Medicine, we could have improvised a kind of supervision, not the dolt of a president who says, I'm the one responsible. My God, it's shocking with all the expertise in this country. But Congress went off on some kind of mind-boggling economic excursion of $2 trillion rather than focusing on the epidemic. They just don't understand what's actually happening. They should be listening to the mayors and the governors because those are the political leaders truly dealing on the front lines. And they should be helping those on the front lines to keep the health workers alive, to get the social support, and to help people to stay home, to shelter in place, and to break the transmission and to stay safe personally. Those are the points of the shelter in place. Stay safe individually and end this transmission, because this transmission, if everybody that now has symptoms and is infected, could be kept sheltered in place in some kind of isolation, given, of course, hospitalization as needed, the epidemic then goes away. Most people recover. Normally, some are hospitalized. Tragically, some will die. But the epidemic does not spread then. This should be the order of business for the U.S. And if it is a bit abstract, all one has to look to the countries that are actually succeeding in doing this to get some lessons, because there are several, as I've mentioned.